Good afternoon, everyone.
Good afternoon.
Welcome. First, thank you so much for joining us. On behalf of Cumberland, Dauphin, and Perry Counties Boards of Commissioners and our respective mental health and intellectual and developmental disabilities offices, we're pleased to share with you all that the work will soon commence on the development of a regional emergency behavioral health crisis walk-in center with our partners from Connections Health Solutions. I would like to introduce everyone who's standing with us here today. Dauphin County Commissioner George Hartwick, who I just saw. Cumberland County Commissioners Gary Eichelberger, Gene Foschi, and Vince DiFilippo. Perry County Commissioner Larry Riesinger, welcome. And then I believe Commissioner-elect Frank Campbell.
Come on up here, Frank.
Welcome. Good to have you with us.
Newport representative.
And then the Pennsylvania Secretary of Human Services, Dr. Bauer Cush, is here with us this afternoon as well. Jennifer Wilt from the Cumberland and Perry Counties local National Alliance on Mental Illness, the Cumberland and Perry County chapter. And then Louis Bianco, a member of our Mental Health and Intellectual Disabilities Advisory Board. And Louis is an important part of our community, working as a certified peer specialist, and he also is a registered nurse. And he'll be sharing his personal journey with mental illness after a while. And Matt Miller from our Connections Health Solutions team. In our audience, we want to recognize Scott Suring, who's the CEO of the Capital Area Behavioral Health Collaborative, and they've been part of the funding picture for this very important project for our community. We also want to recognize Dr. Dale Adair, who's from the Office of Mental Health and Substance Use Services, Steve Ross, and Dr. Jenna Menhart Baker, who's also had an enormous role in finding the funding from the federal government to be able to move the system forward to support our communities better. So what will this mean for our communities? It's no secret that the behavioral health services available to our communities has exceeded or not been able to meet the demand. Unfortunately, this has left a lot of people with unmet behavioral health needs, and we acknowledge that this leads to unsatisfactory life outcomes for our communities and the people we're here to serve. Some of these unsatisfactory outcomes include increased contacts with 911, increased contacts with police, increased contacts with emergency departments, as well as longer wait times and sometimes limited access to inpatient psychiatric care. Increased rates of incarceration for individuals with behavioral health needs, for individuals with mental illness, substance use disorders, and co-occurring needs. Significant increased wait times for all behavioral health services. But you know, one of the things I value most about living here in South Central Pennsylvania is that we all have such a great sense of community. And I can't speak to other parts of the nation, but one thing that I know, we live in a community that really works together with a desire to help others, and I think this represents our values. It's important to note that despite our current present difficulties with crisis response, our communities collaborate well together with our first responders. We have crisis intervention team programs and partner with police, 911, who use de-escalation strategies to help bring a person to get the services and help they need versus incarceration. We also have crisis programs that are housed currently in our emergency departments on Cumberland and Perry. But we're building with Connections something that's going to be able to provide 23-hour stabilization and ongoing monitoring as well as follow-up. And one of the most important parts of this program is peer support. People with lived experiences being able to share their experiences to help another person. And Andrea and Matt are going to talk about this a little more. Our difficult outcomes mirror those of other communities literally across our nation. Concurrent nationally, the federal government is also trying to help. The new National Suicide Prevention Lifeline, 988, was operational in July of 2022. We're fortunate to have one of our 988 call centers right here in our backyard, located at Penn State Holy Spirit in Camp Hill. In February 2020, SAMHSA, the Substance Abuse and Mental Health Services Administration, issued national guidelines for behavioral health crisis care in the form of a best practice toolkit. The guidelines are intended to help counties, state agencies, providers, and state and local leaders plan to develop crisis systems that meet our community's needs. Pennsylvania provided leadership in offering opportunities to help our communities. We appreciate their leadership and their active support. We're honored today to have Pennsylvania Secretary of Human Services, Dr. Valar Kush, and OMSA's Office of Mental Health and Substance Use Services partners here today to celebrate this important next step. These partners provided us with a grant opportunity, allowing the 3 counties to work together to strengthen our crisis service continuum. I'm grateful that our counties thoughtfully considered this proposal. Our crisis programs are literally located about 4 miles apart from each other, separated by the river. Cumberland, Perry, and Dauphin counties made the determination to best serve our communities. We were prepared to roll up our sleeves and develop programming to align with these new federal best practice guidelines. Thankfully, our grant submission was approved. And now I would like to introduce Andrea Kepler, my counterpart from Dauphin County. Andrea?
Thank you, Annie. I want to welcome, thank you. I want to welcome Wendy Johnson, the president of the Dauphin County Mental Health, Autism, and Developmental Programs Board. Thank you so very much for being with us today. So as Annie stated, Cumberland, Dauphin, and Perry counties are grateful for our shared partnerships to include the Pennsylvania Department of Human Services, the Office of Mental Health and Substance Abuse Services, who have approved about $13.1 million in grant funding to create a regional emergency behavioral health crisis walk-in center. Additionally, the Capital Area Behavioral Health Collaborative, the primary contractor for health choices in the Capital 5 County region, will provide an additional $4.5 million in funding to finance building renovations. We are sincerely grateful for the support of our commissioners and all those who contributed to us standing here today. My sincere thanks for every one of you, what you have done to get us this far. Thank you so very much. These combined partnerships are paving the way for the Regional Behavioral Health Emergency Crisis Walk-in Center that will serve our communities in a manner that has never been possible. While I do not intend to disparage any efforts that have gotten us this far to date, it really is far too long. We have relied upon our law enforcement professionals and emergency departments as primary providers of behavioral health crisis response services. For too long, we have not taken the steps needed to assure the critical role of people with lived experience as certified peer specialists, as recovery specialists, to ensure their input in the design of behavioral health services and engagement of people who need to use those services. For too long, people with behavioral health concerns have experienced complications with criminal justice involvements and/or lengthy waits for services when all along what was most needed was 3 simple things: someone to talk to, someone to respond, and a safe place to go. Number 1, someone to talk to. In addition to our local crisis intervention centers in Dauphin and Cumberland Perry counties, the regional 988 call center serving this tri-county area is Penn State Hershey at Holy Spirit Hospital, and now assures someone to talk to 24/7. 2, someone to respond. The Regional Emergency Behavioral Health Crisis Walk-in Center will provide mobile crisis teams consistently available 24/7, 365 days a year to serve all 3 of our counties. 2 unique and critical distinctions are that each mobile response team will respond to crises and emerging crises where they occur. And a team will consist of a licensed mental health professional as well as a person with lived experience in the form of a certified peer specialist or a recovery specialist. The role of peers is part of our workforce to enhance what we do together by assuring individuals with lived experience or certified peers are working closely with others in crisis. Our mobile teams will work in partnership with the police. We know not all behavioral health emergencies require a police presence. We will be able to provide an appropriate behavioral health response to people who are in crisis where the crisis is being experienced. We are grateful for the amazing work performed by our police serving and protecting our communities, and we want to achieve the vision of leaving the police to do this work in the community and not in behavioral health crises. Both of our counties, all three of our counties, are proud of the work that has been done with law enforcement professionals and their engagement in crisis intervention training. We envision the CIT program continuing to grow and serving as the underpinning for all that we do with crisis response services. 3 simple things. Lastly, a safe place to go. The center we envision will welcome all and work to create a pathway for every person in need of services. We will find ways to say yes to those requesting services. Law enforcement professionals will have their own drop-off entrance at the crisis center to support them for quick and efficient access to get the person help so they can respond to other calls. Connections Health Solutions has developed crisis response centers in Arizona and Texas and is nationally known for their positive outcomes. They have been successful with stabilizing the majority of those who walk through their doors within 24 hours without the need for inpatient services, connecting the majority of those individuals with necessary outpatient follow-up supports, and having fewer than 5% of those served readmitted to crisis walk-in centers. These numbers are also demonstrative of the majority of people being served never engaging with the criminal justice system. At this time, I'm very honored to introduce Matt Miller from Connections of Pennsylvania.
Thank you. Thank you, Andrea. I think before I get started, you'll probably hear consistent themes from me, and I did not read their speeches in advance, but you'll hear consistent themes from me, from both Andrea and Andy, and I think probably from the other speakers as well. And when we hear consistent themes, that means we're all collectively working towards the same goal, so that is exciting for us. So good afternoon. My name is Matt Miller. I'm the Chief Growth Officer for Connections Health Solutions, and I've lived and worked in Pennsylvania for nearly 30 years. In my professional work, it's always been in healthcare and specifically in behavioral health care. An honor to represent my colleagues here as well as the rest of the Connections team as we join the community here in Harrisburg today in bringing immediate access crisis response services to the region. I'd like to congratulate and commend the leadership of Cumberland, Dauphin, and Perry counties, especially Andrea and Annie, and your teams for your unwavering commitment and the partnership to addressing and solving for an ever-increasing behavioral health need in the region. The work being led across these 3 counties will save lives. I'd also like to take a moment to thank the representative of the Department of Human Services as well as OMSAS for your ongoing efforts, not only here but throughout the Commonwealth, of bringing crisis care to the entire state. We appreciate it. I'd like to share a little bit about Connections, what we do, and what you can expect from us when we begin services in 2024. Connections Health Solutions is the leading innovator in behavioral health crisis care. For more than 30 years, our person-centered approach has ensured people in crisis, regardless of mental health, regardless of substance abuse, or both, get the care they need when they need it, regardless of insurance, income, or demographic. National industry experts and leaders, including SAMHSA and the National Council for Mental Wellbeing, have adopted our practice as a national best standard. We currently operate 2 of the largest and most studied crisis centers in the country, and as Andrea said, also offer mobile crisis services. We're excited to bring that expertise and our experience here while growing the partnerships with the counties, with the current healthcare delivery system, and with all stakeholders that will benefit from effective crisis services. It's clear that getting individuals experience a behavioral crisis the care they need has been a priority for the leaders and the community members across the region. Currently, the strain in resources in the community is focusing individuals to seek care in emergency rooms, or they're ending up in jails out of necessity. Some may wait hours, some may wait days for treatment, while others get discharged or sent home without complete treatment. Some may not even seek treatment at all because there's not a dedicated place for someone experiencing a behavioral health crisis to go. We know we can do better as a state, as counties, and as a community. Dedicated behavioral health crisis centers are proven to support reduced rates of hospitalization and patient boarding in emergency departments, a place where anyone can go without judgment and be treated for their behavioral health issues, because behavioral health care is health care. Additionally, communities with access to best practice services see a reduction in law enforcement involvement in behavioral health crises and fewer arrests, and individuals receive behavioral health care in a much more appropriate setting. In short, access to better behavioral health crisis care delivers positive impact to the individuals it serves and to its communities. Once these services are launched, members in all 3 communities will have access to a mobile crisis response team that can meet individuals right where they are in the community, working with them and working with their supports to try to address their crises on site. The Regional Emergency Behavioral Health Crisis Walk-In Center will give individuals that safe place to go, allowing for access to high-quality behavioral health services in a dedicated, safe, and treatment-oriented environment, and relieving the pressure on hospitals and emergency rooms. Whether an individual comes to the center through the walk-in urgent care or in the care of first responders, we make sure they receive respectful and personalized treatment that is proven to promote the best health outcomes. Connections is our name for a reason. Stabilizing an individual's crisis is critical, but we also know how important it is to focus on what happens after stabilization occurs. Both our services will connect individuals to long-term behavioral health providers and community resources that exist in the delivery system today, including housing, transportation, and other services, social services designed to help keep individuals in recovery. We're pleased to be part of the community to join Cumberland, Dauphin, and Perry counties' focus on providing dedicated behavioral health crisis care to all those who need it and whenever they need it. And with that, it's my privilege to turn it over to Commissioner George Hartwig. Thank you.
Thank you, David. I first want to thank my colleagues from Cumberland, Perry, and Dauphin. I think the opening statement is the challenges that are in front of us, I think, force us to think more regionally. And as we are able to cooperate, I mean, together as individual counties, we can do so much. But together, building a sense of trust and a regional response, I think we really have an opportunity to address this and be on our toes. And I want to say thank you for taking those bold steps today in order to address an issue that most folks are just pointing their finger at and saying, there's a problem. We want to figure out a way at the local level that we want to step forward and try to address these concerns, regardless of how it happened. And obviously, we have to take responsibility for how we move forward. So I want to thank my colleagues. I also like to acknowledge Commissioner-elect Justin Douglas, who is a new commissioner in Dauphin County. For those of you who don't know him, he's in the back of the room. Make sure you get to know him. I asked him to be here. I know this is an important issue. So Justin, thank you for joining us as well. I'd also like to recognize a longtime friend of mine quickly, Doug Hill, the former executive director of CCAP, who is now the director of our board at the CMU, who is probably one of the wisest men that I know, who has helped guide us in many ways, and I know continues to work to provide solutions, not just point out problems. And also we have Dauphin County staff here with our Director of Human Services, Randy Yeager, our Solicitor for Human Services, Fred Leidy, and Kristen Varner, who's the Director of our Drug and Alcohol Services. And last but not least, Secretary Valar Cush. I remember when we first met, we were on a panel talking about behavioral health, I think at State College, and the opportunity to know both your passion medically and your experience, and also your passion in resolving issues, I think allows us to have, be on our toes rather than our heels as we look to the state for a great partnership and being able to now build out what I think is going to be required as it relates to the rest of the system from a community-based behavioral health perspective. Because this, again, is a result of a study that we looked at in 2017 that really took the Band-Aids off of our behavioral health system, and particularly its engagement related to how we interacted with the criminal justice system. And quite frankly, it's a disgrace that our jails are probably the #1 provider of mental health services across this nation. We know we have to and we will do better. And the ability to do that is not just to look at how we got here sort of with the lack of an investment in the deinstitutionalization process, but how do we figure out a way to bring best practices and the best system and the right partners to be able to work with us to solve the problem. And we are really grateful to bring in Connections. I just want to let everybody know it was an open process. As we had this selection, we interviewed local healthcare providers. We had, a whole load of folks that had a level of interest, and it was Connections' proposal that really was a standout and the reason why there are partnerships here today. So this was not an insider handoff. This was a result of a collaborative and open process that, quite frankly, I think has allowed us to arrive at the best decision. So from my perspective, it really gives us an opportunity to expand and grow both on the partnerships that are going to be required moving forward, and I think what is the biggest public health crisis that we face is really the lack of direct services for the mental health population. Mental health is not a crime. And we should not be putting people in institutions as a result of trying to figure out a way to provide better health care. And we also have parity, which should be providing the same level of care for folks' behavioral health needs as we do their medical needs. And quite frankly, I think with this partnership in front of you, it is a historic day. A historic day to say that we are focused as a region, not on what it is that we get, but what is it that we can give collectively together to be able to create a better system for the folks that we serve. It's not really about the elected officials. We work for the people. And the ability for us to better serve people should always take priority over any of our own personal interests. And I think today is a clear recognition that this region is on our toes and we're thinking forward as it relates to solving these problems. So I'm grateful for the trust that you've placed in all of us, for the work that's been done, our partnership even with the CAP 5 region and Scott Suring, who I see in the back of the room. It really takes true collaboration to make this done, make this work. And today I'm really proud of the ability to stand here, but the work now really begins. It means recruiting staff. I mean, we still face significant challenges in those areas. Staff retention, figuring out a way to be able to provide the level of certifications necessary in order to meet all of the standards, and then putting a team together that have a belief and beyond in the level of service and ensuring all of the counties are served, and I think you heard this multiple times, where they're at in a way that they need that help. So I know we're all committed to making that work, and I am sincerely appreciative to all of those who have spent tireless time and hours pulling this together. It was no small feat, Annie. I know you and Andrea's relationship did not hurt. And we also know that working together, again, this is just one example of the types of things we can achieve. So thank you, and it is my duty and responsibility at this time to be able to turn the microphone over to my good friend from Cumberland County, Commissioner Gary Eichelberger. Gary?
George is always a tough act to follow, but I'll try not to repeat too many things, but I did want to stress what an honor it really is for us to be here and to be part of this today, because this truly is not emphasizing the problem, as George said, but emphasizing solutions. And solutions have been a long time in coming, and I think we recognize this is a good start on some of a solution. I want to share with you just a handful of facts that I believe are unknown and underappreciated to a lot of our constituents. At this moment, the Cumberland County Prison is housing 184 inmates with behavioral health issues. That is 49% of our total inmate population. That gives you some idea of the disconnect that's going on. And so far this year in Cumberland and Perry counties, year to date, 35 residents have died by suicide. And we're not even at the holiday season yet, so that's just from January till now. So through this year, as mentioned, we've been discussing the need for increased mental health services extensively, sometimes with some success, sometimes not. We have a long way to go on that, but this is a great start. So today, this partnership demonstrates the commitment of 3 counties coming together for the greater good of our residents who are struggling with behavioral health issues. When the center and mobile units are up and running, we hope to see shorter wait times in our emergency rooms. That benefits everybody. And fewer people with behavioral health issues who are housed in our jails. And I did just want to call out something here. I'm very pleased to see our law enforcement community represented here today. We thank you for your service and we thank you for your participation in this today. Your job is not an easy one. This partnership will assist our first responders. They'll be able to respond to incidents of behavioral health emergent care, of a behavioral health emergent care patient, take them to the center, bring them to the center, where they'll be warmly greeted and offered help within minutes. That's a huge change for a lot of folks and a needed one. Residents will be able to get the fastest care in the least restrictive setting. And by providing immediate access to care and connecting people to benefits and community resources, we've created a proven and recognized system that puts people on the journey to recovery. I want to thank our colleagues here, Commissioners of Dauphin and Perry counties, along with so many other folks, our mental health administrators, Annie, Andrea, for taking the lead on this project. And not just that, but to celebrate the blessings we have as a community to have so many active, engaged, capable individuals who have made this a priority. That's exceedingly important if we're going to succeed, and we are going to succeed. So with that, and I want to offer the final thanks to the Pennsylvania Department of Human Services. They provide great leadership in assisting our counties with programs that positively impact our communities. And as a natural follow-on, it's my pleasure to introduce Pennsylvania's Health and Human Services Secretary, Dr. Valerie R. Cush.
Good afternoon, everyone. Thank you so much, Commissioners Hartwick and Eichelberger, for inviting me to join you today. This is really exciting to be here as this extremely important project kicks off. I want to take a moment to acknowledge one of my colleagues, our Secretary for the Department of Drug and Alcohol Programs, Dr. Latika Davis-Jones. Welcome. And thank you. And also just want to additionally give a thank you and a shout out to some of our folks here from OMSAS, led by Dr. Dale Adair. They are the folks that do this work every single day, and I am honored to have them on my team. All Pennsylvanians deserve access to timely, no-barrier, person-centered behavioral health supports that are delivered without stigma, without discrimination, and without prejudice. This can include regular appointments with a therapist or a counselor, a relationship with a psychiatrist or a primary care physician who helps medication management, or being part of a peer support network. But access to behavioral health care is more than just day-to-day management. Just as people can experience an acute physical emergency, such as a stroke or a heart attack, behavioral health emergencies can also occur. And in these moments, it's crucial that they have someone to call, someone to respond, and if needed, somewhere to go. For decades, that someone to call was always our local police, and we thank you for that response and that service. But that's not always the optimal response, particularly for a person who's particularly anxious or scared. And so as we move forward with projects like this one, we now have a 988 system to call. We have mobile response teams that can respond. And now with this collaboration between Cumberland, Dauphin, and Perry counties, a very, very special place to go. I, as you heard, am a physician, and I can tell you with certainty that someone who is experiencing a behavioral health crisis does not need or often benefit from going to a hospital emergency department. In fact, that is often one of the worst places to go. It's not set up for that type of care. These types of centers are what we need, places where all of the staff is trained, the environment is conducive to a calming, therapeutic, safe, and supportive environment, and that the individuals that are working there are trained on how to respond to behavioral crisis and to do so without stigma or judgment. So I'm so excited to see that this will be stood up, and I want to commend all of you, particularly as a former county commissioner, for working collaboratively as counties. We have 67 counties in this Commonwealth. We don't have to reinvent the wheel 67 times. These regional collaboratives are critical. It is a way to take each county's resources and multiply them. And the Department of Human Services and the Shapiro administration is honored to be part of supporting projects like this one. So kudos to all of you for getting this done. I know it's not always easy to work across those county lines. Believe me, I know. So as we continue to support our behavioral health infrastructure and the Pennsylvanians that it serves, be it through the first investment in county mental health funds in 15 years, or through the governor's establishment of a Behavioral Health Council, this work is a priority for me, for the Shapiro administration. I'm going to take some privilege to speak for Secretary Davis Jones. We work collaboratively and together every single day with a focus on this type of work. We know how important it is. So together we applaud all of you for the steps that you're taking to build this collaborative. Your work will help so many people across your 3 counties, but perhaps just as importantly, it will be a model for people in other counties across our Commonwealth about what is possible. So kudos to all of you. I can't wait. I hope you invite us back for the ribbon cutting. Okay, good. And congratulations to all of you. Thank you.
That's okay.
I'm sorry.
It's okay. I'll introduce myself. Hi, I'm Jen Wilt. I'm from NAMI. NAMI is National Alliance on Mental Illness, and we're from Cumberland and Perry County. So I am really thankful to be here today as we see this front line. What NAMI does is we are advocates, we do support for families, and we also do education. So this is really huge, and it's awesome to see that you guys have heard our voices, because we have been speaking, we have been writing, we have been talking, and it's really a crisis out there. I'm aware of situations right now in York County Hospital, somebody that has been sitting there for over 3 days waiting for a bed. So just the fact that we're going to have something new out there that is going to be implemented and looked at the person holistically is amazing, because you can't imagine how scary it is when somebody gets picked up from a 302, which is an involuntary commitment, and has to be taken by police, a lot of times in handcuffs, to an ER, and then put in a stark room. So the fact that we are having some other options out there, we're excited. So I want you to know that we will be a big part of being out there and working with all of you, with Dauphin County NAMI, even York County NAMI. There's a lot of affiliates out there. So whatever you need us to do, we will pass it on to our families and to our parents. The same thing we did with 988. They're aware of that. You know, they're aware of the CIT training, the crisis intervention training, because we let them know that in our classes to say, hey, we're in a crisis. Do you have a CIT trained officer that can come in our crisis? So there's so many things. Keep feeding it to us, and we'll keep feeding it to them. So thank you for having us here. Thank you.
Hello, my name is Louis Bianco. As it was announced earlier, I am a registered nurse. I served at the Pennsylvania Psychiatric Institute as a charge nurse for child, adolescent, adult, and geriatric, and I was also a lead crisis de-escalator. I am a peer support specialist. I worked at Holy Spirit Inpatient on a 2-year grant to get an evening shift peer specialist position put onto their inpatient unit, and that was successfully entered into the budget. And I've lived with bipolar now for 25 years as a 40-year-old. However, currently I work in a kitchen as a prep cook, slicing tomatoes and washing dishes. And that is because recovery is not always as easy or glamorous as it may seem. My nursing license is still active, by the way. When this all started for me in the late 90s, there were no facilities like this. There were no peer support specialists, so it was inpatient. And that inpatient care took me weeks. I've been hospitalized more than once, so sometimes months. And oftentimes what you find is that you start to lose the world around you because it keeps going while you have to stop. I had to do a lot of my schoolwork in hospital basements to graduate with my peers. But I did. I dropped out of college twice before finally getting my nursing degree. And there was an inpatient hospitalization during that process. And each time I had to be hospitalized, the world kept moving forward. Facilities like we are talking about now can possibly change that narrative. It wasn't to say that the inpatient care did not help me, because it did. So I will never say that an inpatient stay is an unnecessary step, given certain circumstances. However, not every crisis that I experienced required me to be removed from society and lose everything that I had earned. The money I made as a nurse all went away to my medical bills. I had $2,000 left in my pocket, and I spent it to become a peer specialist so that I could make that money and once again need inpatient treatment, and that money is no longer around either. One of the things I asked for during the selection was that people who are qualified to be peer specialists don't have to pay that kind of money to find a place to offer their services. And it was very important to me that Connections said that they would help those people find their way into positions such as being a certified peer support specialist or a recovery specialist. Because the reality is this is an expensive life, being in recovery. I have very little money, even though I worked at higher end jobs. And I have limitations at this point that I'm not sure I would have. I don't know what my life would have looked like without a facility like we are discussing now. But that's okay. We are here now, and it's happening now. And I couldn't be more happy about it. Peer specialists are an incredibly important part of the process of treatment. I was grateful to be on a treatment team with therapists, psychiatrists, behavioral health workers, nurses, and that spectrum of disciplines is incredibly important. We always learned in nursing school to start with the least invasive and work our way further if necessary. So a peer specialist to me is the least invasive beginning. You can try to meet somebody where they are at. We were told that we are the experts at not being experts. And oftentimes the peer specialist may be able to de-escalate a crisis before anybody else is necessary. However, it will remain imperative that we have those other parties necessary. It will remain imperative that we have inpatient facilities because, as I said prior, all circumstances are different. And there were times in my life when my crisis required inpatient stays. It is my opinion that there were times when it didn't. So, in closing, I would just like to say the steps that we are taking to move forward shows how progressive we are right here in central Pennsylvania. I started advocating over 15 years ago. It is an honor to be here for this moment. I go into Holy Spirit every month and do healthcare assessments of the people in their intensive outpatient program. I can tell you that I am not here to speak specifically about myself and that I am speaking for the mental health community as a whole when I say thank you and let's continue to push forward with these types of initiatives.
Thank you, everyone, for coming. Louis, thank you. Thank you all. And with that, we're going to close our press conference. And I just want to let our media friends know that we will be available if anyone has one-to-one questions you'd like to ask. And we hope you'll join us next year for the ribbon cutting. Thank you so much.
Thank you.